If you've been wearing a face mask during the coronavirus pandemic, you may have started to notice some issues with the skin around your nose and mouth. That's because sweat and oil can build up under the mask, which can cause acne. And the masks themselves can also cause problems for sensitive skin. Kayce Hansen is a licensed esthetician with KELOLAND Medical Spa, and she's joining us with some advice for how we can stay safe by wearing a mask without damaging our skin in the process. Welcome, Kayce.
Hello.
Thanks so much for joining us here today. First, I just want to start off by talking about how wearing a mask affects our skin.
Yeah, so we find that wearing a mask, it can be a little bit warm and we're not really allowing our skin to breathe. So our pores can get clogged more easily around that area. And then just because we're not washing as much, so it's really important that you wash your face a lot right after you take your mask off, because we really want to keep those pores clear, and you may find you want to exfoliate more as well.
So when we have a mask, a lot of us will just, put it on, take it off, and keep using the same one a few times before doing it. Should we be washing it more often than not? How many times do you recommend?
Right. So if you can, right away when you get done wearing your mask, as soon as you get home, you should wash your face. Of course, wash your hands first. And then just because that mask is, sitting there and it's not letting your skin breathe, so the dirt, oil, whatever is on your skin is just sitting in those pores. So if you can wash right away, that is super important.
How does also having makeup on at the same time as your mask also cause problems?
So makeup underneath the mask really just creates more of a barrier between your pores, and because those pores already can't breathe as well, then you're kind of just creating kind of like a breeding ground for like bacteria, and really just pressing that oil more into your skin, which is going to cause those breakouts.
So for some people who have had these breakouts because of wearing a mask and now are trying to get it under control and get their skin back healthy, what are some steps we can take to do that?
So it's really important that you aren't touching your face even after you take your mask off, but you want to make sure you are washing your face morning and night. Exfoliating, some people find that they may need to exfoliate as much as once a day because their skin just needs it more. And of course, just protecting our skin and wearing moisturizer and maybe going a little lighter with your makeup in that area.
And if we do have those spots, since we have a mask on, should we be using a spot treatment? And can we do that during the day if the mask is covering it?
You can. There are different exfoliating products you can wear during the day. And then even at night, it's really important to use a retinol, which is going to speed up that cellular turnover process and then help get rid of those breakouts faster.
Now, I know you mentioned how important it is not to touch your face, and that's just in general, whether or not you have a breakout. But when you do have a breakout, a lot of times we as humans love to pick at it. What should we be doing instead of that? Or why shouldn't we be picking at it?
So we shouldn't pick at it because we can actually make the breakout worse. Sometimes we're like in the car picking at it and your hands aren't clean when you're touching your face. So it's really important that we don't pick because we don't want any more bacteria in there. And then we also don't want to cause any type of scarring. So it's best to leave it be. And then at night, you can spot treat it or use your retinol. And of course, exfoliating helps as well to get rid of those breakouts.
You mentioned washing your face morning and night and how important that is, but how important is the products we're using to do that? I mean, medical grade skincare is something that KELOLAND is so passionate about. So just tell me a little bit more about what products we're choosing and how that can also affect us.
Yeah, so one of the perks of coming in to purchase medical grade products is that you are getting your skin evaluated by a professional. So they are going to take into account your skin type, what's going on with your skin, and then really accommodate those products to your skin type. And so when you're at the drugstore, you might be picking out a product that is for someone with more oily skin and you have really dry skin. So you aren't going to be using the right product necessarily.
Are there any treatments you would recommend to come into Kalon to get to help with these breakouts or help so that they don't occur?
Yeah, so we have a few different types of facials that are really great for clearing the skin, as well as chemical peels. And we have different levels of peels based on what your skin needs, and that is one of the best treatments for treating acne.
And now one of the things we're all trying to do too right now, especially with this beautiful weather we're having, is spending time outdoors. Now, if people are wearing a face mask outdoors, you can get a tan line, which a lot of us probably don't want. I know as females we can cover up with makeup and try our best with that, but what can we do if we get that tan line?
Oh, goodness. So I always say it's so important to be wearing your SPF every day. Even if you're not going to be outside, you should always be wearing at least an SPF of 30 or higher. So it's really important that you are applying sunscreen every 3 to 4 hours, wearing a hat, staying out of the sun. But if for some reason you do get a tan line, it's best to just keep going with your skincare routine, and then sometimes makeup can help cover up those tan lines as well.
All right. Thank you so much, Kayce, for joining us here today. You had a lot of great tips, so thanks for your time.
Thank you.